All right, so the SOAP note is regarding 75-year-old male was seen today for a follow-up receiving lab work this morning. Um, Patient had no complaints at the time when we did our assessment. He does endorse fatigue, but that is something that has been ongoing with him for quite some time. And that was also the primary reason as to why he was getting further lab work done. So past medical history, MS or oropharyngeal dysphagia, dermatitis, psoriasis, glaucoma, hyperlipidemia, dementia, allergies, hypertension, neurogenic bladder, depression, seizures, convulsions. I guess they should add in there some form of weight loss because he did have significant weight loss over the past year per his trends. He has allergies to wool. Review of systems. So denies chills or loss of appetite. So just to kind of discuss a little bit more. So he eats everything. During our assessment, he ate all his breakfast, ate all his lunch, but he has lost, I think it's a total of 14 to 20 pounds over the past year or so, along with his concern for being so fatigued. It was kind of more to look towards if this patient had some form of cancer. So respiratory, denies any shortness of breath or difficulty breathing with pain. Cardiovascular, denies any chest pain. GI, no abdominal pain or no tenderness noted from the patient. Neuro, denies any headaches. He does endorse tingling in his hands, but per the patient, that's normal, and as well as with the nurse. When I was doing my assessment, she was there helping me turn him and talk to him as well. So that's normal. That's his baseline. And psychiatric, no changes in mood or behavior. Vital signs were stable, 121/67, 78 heart rate, 19 respirations, 98.2, and 96% on room air. So as far as his physical exam, he's an elderly male, not showing any signs of acute distress. Upon entering patient's room, patient was resting in bed watching TV. His lungs were clear to auscultation, bilateral lung sounds, no rales, rhonchi, wheezing, or cough. CV, listen to his heart sounds. Apical pulse was within normal limits. No murmurs noted or heard. GI, he did have some pain upon palpation. As far as his, nope, sorry, wrong patient. Forget that. Sorry. No abdominal distension, no pain. There was no pain with him. I'm sorry. I had another patient who did have GI pain, but that's not him. Sorry. And it was soft, flat, and bowel sounds were present. Neuro, baseline was normal for the patient. No changes in upper or lower strength. And psychiatric, mood was pleasant, and he did have a flat affect. But that kind of goes in line with his history of depression. So with assessment and planning, patient was referred to hematology shortly after, and for consult for further evaluation. So this had been discussed before. The issue was that the patient has a DNR. So the next level, as far as we were going through all the lab work, and the nurse practitioner, Pat, she was like, have a look through his chart and really kind of see what you would think to do with him. So I actually have a lab value book that I bought to kind of like break down a lot of the stuff. And I kind of went through because he had elevated platelets. It said that when I was reading through the book that I had, there's certain medications that could elevate his platelets, but there was a time where his platelets did decrease as well. But no matter which way we kind of sliced this and looked at it, it all kind of like boiled down if he had a more advanced or severe stage of anemia, that the next stage would be the bone aspiration. So along with his symptoms that he was having with the fatigue and the significant weight loss over the year, again, with all his lab works, he wasn't showing any signs of infection. His appetite is normal and no GI and nothing GI related. It was all kind of narrowing towards the bone marrow aspiration. Per his sister, who is very involved in his care and more or less his POA, I believe, because she came in and it was discussed and she went through everything. The consultation from hematology oncology basically said that it is recommended to have a bone marrow aspiration done to whether confirm there being cancer or to see if there was anything going on in that aspect. There was other lab work that there was going to be ordered. It was a JAK2, which is, we looked it up together, and it's a form of protein. Again, it's more so leading towards like the other lab work that was ordered by more specialty from hematology oncology. Again, regardless of what it came back as, the bottom line would be that this patient needs a bone marrow aspiration done to see what's going on and to basically ideally diagnose what is causing this patient's excessive form of weight loss plus his fatigue. So this was a pretty, it was an interesting case. It was an interesting patient to talk to and kind of review his chart. So as far as time, it was just kind of like seeing what the choices are. If this was some form of cancer, how long would the patient have? But again, there was no way of saying how long, considering that he was, to say the least, alive and well. He was still living a nice life at the community living center. So this was a good way to kind of like look at all angles and involve family and just kind of brainstorm with others to find out what would be the best plan of care for this patient. So it was nice to kind of look at and review everything and review all aspects and trying to do right by the patient, not to go so invasive and put the patient under unnecessary procedure, such as the bone marrow aspiration, especially if it's not going to result in, if he does come back, if it is confirmed that he does have some form of cancer, what kind of quality of life would he have with the chemo? So it was nice to be able to really look at all aspects of this patient's life, to say the least, and find what would be ideal for both patient and family. So that was this week's SOAP Note. Thank you.